Okay, everybody is listening so intently. It's great, and I realize it's been a long time. We are coming to the last part of the session. Not least, though, the opioid crisis. This is something we've been saying really doesn't need any introduction. There is not a day, and we've been doing this, I guess it's been 2 or 3 weeks now since we started, and so I've been aware of saying that and know that every day there is something in the news about opioids and the crisis that we're in. I heard a lot about it on the way here, actually, and in fact, as I was driving into the hotel, I was hearing from the medical officer of health here in this area about an injection site opening and some statistics actually about the prevalence in this particular region of the province and the numbers here being higher than some of the provincial numbers. As I turned off the car, I heard him say that it's about 35 to 50% higher for death rates in your region than it is in the province. So I'm going to share with you a few numbers, not that it really needs us to remind ourselves, but it does help in terms of understanding the importance. So the death rate, it is continuing to rise. We don't have good data. Ontario in particular, I think people probably know, is struggling with getting current data. So some of these numbers you'll see are a little bit old. What we know is that because they're old and not current, they're under-reporting what is actually happening. So some of these are staggering and they're underreported. The rates are still going up. We're not coming down yet. Emergency room visits, and Nancy talked about this a little bit just in general, in opioids. Over, 100 people a day in Ontario that are, or across the country that are in emergency departments because of opioids. This number, 1 in 7 Ontarians that are prescribed or were prescribed opioids in 2016. I find this number interesting because it translates to the title of a report that Health Quality Ontario put out, which is 9 million prescriptions that are sort of dispensed prescriptions that were a result of that 1 in 7 Ontarians. That's a staggering number. And the last one, 734 people in Ontario. Excuse me, take a look at how old that data is, 2015. The numbers are still going up. So more than 2 people a day in this region. That is even, as I said, up to 50% more than the average. And one of the other things that I read just very recently in British Columbia, where we know they are sort of ahead and things are coming, their death rate at the moment trending for 2017 is up 88% from where it was a year ago. Scary numbers. So it's important. There's no doubt this really is a crisis, and everybody is doing something about it. Governments at all levels are engaged. They're putting resources into it. They're putting strategies in place. So probably not a surprise to anybody, and I know you will have seen this, or I expect certainly if you've been taking a look at some of the things coming out from the college, you already know that we have a strategy in place. The college recognized that we needed to also align what we were doing with some of the other strategies that were in place. So as I said, you've probably seen this, and in fact, I'm not going to spend a lot of time on it. I know that you're going to see it again very soon in Pharmacy Connection coming out. It is sort of one of the lead stories in there, so you'll be able to read a little bit more about it. The strategy essentially has 4 priorities, as you can see, going around the outside circle. They're pretty probably expected kinds of strategies. They do align with the other strategies that you would be reading about: education, looking at harm reduction, prevention of overdoses, and quality assurance. So just to give you very quickly in terms of those priorities, what are the kinds of things that we might be taking a look at? I think education sort of speaks for itself, making sure that individuals have the information that they need. What is out there? Do you have what you need at your fingertips to be able to do and to focus on appropriate dispensing? Certainly education focused at appropriate prescribing is for other folks. Looking at over here in terms of harm reduction, Pharmacy is already engaged in this. If you think about naloxone, something that is already happening, and pharmacy is quite engaged. But we need to make sure that we have that happening as much as possible. So are we making sure that everybody who is at high risk is actually getting naloxone as they need it? We know that there are some examples where that's not happening. How do we make sure, again, you have it and the high-risk folks are getting it? Looking at prevention of overdose. One of the things that we know we can do here is very much focused on that appropriate dispensing, appropriate prescribing. And so taking a look at one of the initiatives we're looking at here is working on development of a tool that would be the morphine equivalency, a tool that would be used to assist in making sure that appropriate prescriptions are going out. And quality assurance. This one is really about sort of making sure that we're using all the information, we're looking to data, we're looking at how you have the data you need, and we are using the data to help you in doing what you need to do for your patients. In the middle of the strategy, you find there are 5 areas of focus, sort of levers that we've talked about, and they're pretty straightforward. So looking at practice tools, what does that look like? How do we make that available to you? I want to just note that on your tables you have a resource tool or a paper that points you to a number of the resources that the college has available. We have a lot of information about opioids, and there's a whole page that will refer you to a number of other resources. So that is there for you, and you'll see there's sort of other places where I want to reference that as well. So making sure that you have access to the practice tools and the resources that are available for you. Scope of practice. Or do we have pharmacists, pharmacy technicians practicing fully to the scope that you have in a way that you can assist people and assist with this particular crisis? And or are there things that we need to be doing to perhaps enhance that? And I think, again, one of the strategies we're taking a look at is recognizing that pharmacists have a great role to play in assisting with the tapering from opioids. And so in order to be able to fully access pharmacists' ability to do that, you can do it in a collaborative practice now, but perhaps there's need for greater scope. You could be identified as practitioners under the Controlled Substances and Drugs Act so that, in fact, you could be assisting with tapering much more. So that's an example of where we might use scope of practice to assist. Best practice evidence, again, much aligned with education, making sure you've got the most current information you're following, and we're getting out to people, educators are getting out to people the best evidence that you need to make your decisions. Data, as I said, that's tied in very much with our quality assurance. Are we using the right data? There is data available. How do we draw from that so that we're making informed decisions, knowing where we need to put our energies? We know, for example, that there's work to be done in emergency departments, in hospital operating rooms. Are we using the data for informing us around that? And then collaboration. There's nobody that's going to solve this on their own, and we have to work together. You have to work together with your team in pharmacy, with your team externally in the system. And we have to work together with government, public, so many different players. So collaboration is a big part. Okay, so what are the key messages, really, for you in terms of the opioid strategy? Excuse me. You've heard this a lot. Your patients need you to be stewards. They need you to be engaged in this particular crisis and to be a part of the solution. Whether you're a pharmacist or a pharmacy technician, they need you to contribute to the solutions. If you think about it, pharmacists really are the experts in this area. There is no other profession that has the same degree of education in terms of medications. And so that expertise is needed to help solve this problem. We need everybody to be using that knowledge. And as I said then, it means that you really need to be stewards for opioid prescription management, recognizing that that may require some very tough conversations. It's difficult to talk to a patient about this. It's difficult to challenge, to inform. Likewise, the same thing to do that with members of the team, with prescribers. It's difficult to have those conversations. Learning how to do that, having those difficult conversations, is part of the stewardship that your patients need you to do. So you'll hear lots more about the opioid strategy, lots of examples that are coming out in the Pharmacy Connection. You'll have to watch for that and see what are some of the initiatives. The college has put together, part of the task force that developed the strategy, created quite a lengthy list of initiatives for the college to take a look at, and the work that we're doing now is to go through all of those initiatives, identify what the priorities are, and then begin that work. And as Nancy said earlier, excuse me, we're going to be looking to drawing on experts. So some people here that may have an interest, some expertise, and also those people with some lived experience. We're looking for some of that to come together to help us in this particular area.